So I'm walking up to the hospital. I really don't want to do this. And I don't know if it's like my anxiety on full throttle, which I'm sure that it isn't full throttle. I really don't want to do this. I really just want to cancel. So I'm like weighing the pros and cons of just not even going.
They trust me with an iPhone.
I know, me too. I was thinking the same thing. I'm the clumsiest person ever.
Hi, Elaine. They had called me to come in for 11:30.
Oh, okay. What's your date of birth?
2/21.
Okay.
I assume I'm in the right place, but I'm not sure.
You are.
Okay.
And day is the doctor for today?
Yep.
Who would you like us to call when the procedure is done?
My mom, Tina. I don't want to do this at all. What's up, everyone? Welcome back to my channel. It's Miss Official A. This is the second day home. My procedure was yesterday at around 1:30 or 2, and I didn't go home till about 6. But first of all, I had a septoplasty where they fix your nose from the anatomy, making it so you can't breathe well and drain things when you're sick. And I also had surgery on my sinuses. I don't have any frontal sinuses like I told you before. And so it was these ones, the sphenoid sinuses. And no, these ones are not the sphenoids. The sphenoid is behind your eye. And then these ones, and the maxillary sinuses in the front. When I woke up, there was just like a bunch of like mucus and blood in my throat, and my nose was obviously not usable, and it made me like panic, and I was so thirsty. I remember she brought some ice chips in and just like put them on the table like so far away from me, and I was just like, can I please have some water? And then, anyway, they moved me to another room, and they put me in a wheelchair after I got dressed, and then my mom picked me up. And this is the third gauze thing. The doctor that did it, his technique is to put tape on a rubber band instead of changing the tape all the time. So I just tuck in a gauze that I fold in threes underneath. I feel like my nose looks the same. You know, I was a little nervous about it looking different because that's not why I went in for the surgery. I'm not going to show you what it looks like underneath here right now because it's like gross. But yeah, I did it. I had like little panic attacks before. My eyes are puffy because I was crying because I was like, why am I doing this? Like, maybe I should just walk out. Like, and then after I had it done, I was like, I panicked and I'm like, I should have never did this. I should have never did this because it's like your face and your breathing and everything. It's I've never done this type of anything before. Only other time I even had surgery was when I was 9. I got my tonsils out. So this is day 2. Had it yesterday. I slept last night. They prescribed me oxycodone, 1 every 4 hours, and I took 1 yesterday, and then I took 1 in the morning. That's it so far. And it just made me sleep. It just helped me to sleep without being interrupted, you know. So I'm sleeping with a bunch of pillows like propped up. And yeah, my throat's kind of dry. I'm thirsty, but it's better than I thought it was going to be for sure. So I'll touch base with you guys again later. Bye. What's up, everyone? Welcome back to my channel. So tired. This is day 3. It's my second full day home. And I can't breathe in or out of my nose. So drinking is like really hard. I can just take little baby sips. And right here is still sore from, I guess, where the breathing tube was. When I drink, there's like this, like I can feel like pressure like popping or something in my nose. So I can't, like, you know, you're drinking, you're breathing in your nose, but whatever. And I still have this thing on my face, but there's not much coming out, as you can see. I don't think anybody wants to see what's underneath the cloth, so I'm going to keep it to myself. I've been sleeping, and I'm already like ready for this splints to be taken out on Friday. But yeah, that's the update. Not much has changed. I can feel like blood right here at the end of my nose. Alright, we'll update you again tomorrow. So today is day 4. Today's Monday. I had surgery on Friday. And I'm a little bit miserable. My anxiety has kind of been getting the best of me this morning. I still can't breathe in my nose if I don't talk really, really quiet like this. Even when I talk like this, stuff is like moving around in my nose. I can't taste anything. It's still hard to drink. It's harder to drink than to eat, because when you eat, at least you can hold the food on the side and take a breath. But when you're drinking, it's like, it's hard. It's almost impossible. And then I end up I like swallow, and then something like pops in my nose. Like even just now, you can hear it. I get stents out at the end of the week on Friday. So I just have to get to Friday. I've been watching a lot of movies on YouTube, like the free movies that they have. I watched, I just put on Dying of the Light, but I'm not really paying attention to it. I watched Taken in Broad Daylight. I watched The Girl in the Basement. And I watched, Extortion. I like that one. He went on vacation with his wife and his son, and he rented a boat from the locals, and he took it out too far to an island to play Treasure Island with his son, and they got stuck out there. And the story is like him trying to get back to save his wife and his son, because some fishermen come by and they kidnap him and try to extort him for $1 million. And they tell him that the only way they'll help him and go back to get his wife and kid is if he gets the $1 million. And it's good, it's free on YouTube. It's called Extortion. So I took a shower today, and it had all like the steam, and it just feels weird because, you know, you still can't blow your nose. I'm trying not to be upset because, like, that doesn't, you know, when you get upset, your nose, like, I don't know what to even call it, if it got stuffier, or I don't even know if I still have the anatomy that creates, like, mucus in my nose. I think you might have taken it out. I don't even, maybe he just reduced them, or he took the junk away from around them, or I'm just used to, like, being able to move around and handle my life and not have to rely on anybody else. I don't know, like, today's just hard. So I'll either update you later or maybe tomorrow. Hey everyone, welcome back. It's day 5. And it's pretty late. I didn't do an update all day. Today was kind of rough. You can hear my voice. I still obviously can't breathe in my nose. My anxiety was a little rough this morning. I'm able to drink better. I don't know if I told you guys before, but I kept having headaches, especially like sinus feeling headaches where it's like pressure behind your eyes and around your eyes. And today I didn't have as much of a headache as the previous days. I continued using my saline rinse, and I think maybe some of the, because I'm one of the 5% that has no frontal sinuses here on the top. So I just have these sinuses here, the sphenoids behind the eyes, and the maxillary underneath the eyes. So they have packing up here. And it says the more I use my saline spray, the more that it will dissolve, or the quicker it'll dissolve. So I've been using my saline spray all day. I use my antibiotic ointment. They have you put it on a Q-tip and just put it like inside your nostrils. They had given me an antibiotic, and that's done now. It was like 2 times a day for just 3 days or something to try to prevent any infection. The pain is not unbearable. The inability to use my nose. and like normal functions of my face has me pretty anxious. But today is Tuesday, and on Friday I get the stents out. So I'm gonna touch base with you guys again tomorrow. My nose kind of looks still the same as it did before. It's still obviously gonna be swollen. And yeah, I'll check in with you guys again tomorrow. Hey guys, welcome back. Not gonna make this one a long one. I am still congested. You can hear it in my voice. Right now I have the hiccups. Hopefully they're gone as I say it out loud. I had like upper teeth pain, which I don't have like cavities, so it's not like cavities. It's like my upper jaw, like that holds my top teeth, was like sore. I still have like drainage, and I'm still using my saline spray, and I'm putting in the antibiotic ointment. I can feel the stent on this side right at the edge of my nose, but this one's not. I still can't taste or smell because the stuff's still in there. It's way easier to drink though, so whatever part was like had moved or was not in the same place that was allowing me to drink before, it's like getting there now or whatever. I don't know how to say it, but I'm able to drink, and eating still not really hard. I've been using my humidifier and like at least more than three, but times a day I'll like use the humidifier, get the steam going, use the saline, put the antibiotic in, and then I'll put this back on, which I got some more tape and gauze. But I'm sure the procedure went exactly how it was supposed to, and I'm sure that I'm healing fine. I don't feel like I have any like infections or anything like that. So today's Wednesday, and Friday I get my stents out. So I'm gonna keep doing a little bit of an update, and we'll see what it's like after Friday when I get my stents out. And then I still have another week off from work after that, so I've been catching up on a lot of free YouTube movies, like which I did say the other day. So today I watched the Salem Witch Trials, and I've been watching I Survived. It's like a series, and they put it on YouTube, and it's like how they survive certain things, like getting struck by lightning, being stranded at sea, being abducted. And yeah, this is like the most television that I've watched in a long time. So yeah, that's it. Obviously I'm a little bit hot, like my spirits are a little higher today. My anxiety wasn't so bad today. So yeah, all in all, it was a pretty relaxing day, and I'll touch base again tomorrow. Alright guys, so I didn't pick up the camera yesterday. I felt like I almost did, but then I went to sleep. So I took the bandage off. I still can't breathe or talk well, I can't breathe through my nose at all, but I'm back at the doctor's, and she's gonna take the stents out. My son headbutted me wicked hard yesterday. Well, not headbutted me, I think he just hit me with his hand. He headbutted me at one point and hit me another time. So hopefully that doesn't impact me too much, but I'm gonna go in, get the stents removed, and hopefully I can breathe. Oh, this hurts.
Any COVID symptoms today?
No.
Any exposure to COVID in the last 2 weeks that you know of? Any upcoming COVID testing? Perfect. Have you changed your address, phone number, insurance?
No.
You're all checked in.
Can I take this off? Yeah. I just hold it or? Okay. It's gonna look nasty, but she's totally
She wants to see
yeah,
it.
she's outside waiting. Yeah.
No worries. Head up a little bit for me. All right, I'm gonna have you turn towards me. I'm just gonna cut the stitch, okay? Bear with me here.
It almost feels like this one's like down more than this one.
And
Or-
sometimes they can shift a little, yeah. There we go. All right. Yeah, so they can't really move far, but they can shift a tiny bit sometimes. Alright, I'm gonna have you hold that.
Do you mind if I shouldn't have did
Yeah,
that?
no, you're fine.
Sorry.
Don't worry. No worries. You can hold that off to the side a little so you can
Yeah.
video. Alright.
There you go. One. Felt great, actually. Get it out of there, right? Turn just me just a. Yeah, it's just kind of where it is.
You okay?
Yeah. Try not to hurt you. Woo! There you go. Oh, yeah. Whew.
Okay, that's it, guys, and I don't know what to think. The stents, the splints, the stents are out. I actually can breathe in my nose. It's weird. I feel like I'm still like not breathing in my nose. But my son like headbutted me 3 times this week, and the lady said it still looks perfectly fine. So okay, so the last clip cut a little short, but my stents are out. I can breathe through my nose. I got Dunkin' Donuts today, and it tasted amazing. I got an avocado toast with bacon and a large iced coffee, and it literally tasted better than I remembered it from before. So she said keep using the saline rinse, keep using the antibiotic ointment, and that I'll be blowing a lot of stuff out. So the last little special that I have for you guys in this video is for the people who like the oozy gooey stuff. Like, I personally definitely watched videos of people like using the, not saline, but like the different devices to get the stuff to come out of their nose, and like looking at all the nasty stuff that comes out once the stents are gone. So I have a little picture for you for the end of this video, which is what's coming up next. Fair warning, if you don't like that stuff, you don't like boogers and gooey stuff, don't, like, this is the end for you. And thank you so much for watching this video. But if you want to see what my first good blow was after I left there, I'm going to put a little picture in. And this is literally just to document the full thing, you know? Like, literally, like, I was looking to see, like, the same type of stuff when I was researching it. So I'm adding it here. Like I said, you don't have to watch this. But yeah. And I feel so much better. I'm happy I got the surgery. Like, literally, it's not the same as it used to be. Like, they used to like do external incisions and like black and blue and all this stuff. He literally goes in endoscopically and takes out pieces of cartilage and bone that are obstructing your nasal passages, and then once those are removed, you're all set. Like, and so moving forward, I feel like this is like, I feel like I made the right choice. And you know, I'm not trying to be too hard on myself. I was watching this back and I was kind of feeling like silly for getting anxious like I did, but it's literally just a part of life. Like, a lot of people have anxiety and things like that, and I'm one of them. So whatever, I added it because it was part of the journey. So thank you guys so much for watching. And if you guys are getting the surgery, it's not that bad at all. Like, you see in the video what parts were hard, you know, but my anxiety built it up to be worse than what it actually was. So now that it's all over, I can look back and say it was definitely worth it. So thank you guys for tuning in, and until next time.